X doesn't always mark the spot. Milestones, nature, needs, and sexual development of gender and sexual minorities throughout the lifespan. As we prepare to examine what is a very in-depth topic, I would like to provide a roadmap of what's lying ahead. We will be covering things such as sex versus gender, what it means to be intersex, reproductive systems, sexual orientations, and then we will go into looking at both sexuality and gender throughout the lifespan in sections such as infancy through toddlerhood, early childhood, middle childhood, adolescence, early adulthood, middle adulthood, and late adulthood. At the very end, I will include references to works that have been cited and used for this presentation. To begin, let's discuss sex versus gender. Sex, gender, and intersex, oh my. Understanding definitions of terms is important for setting a foundation on which to discuss this topic. So I have some definitions here, both from World Health Organization and also from Interact, which is a nonprofit organization dedicated to intersex people. Sex is different biological and physiological characteristics of females, males, and intersex persons, such as chromosomes, hormones, and reproductive organs. Whereas gender is the characteristics of women, men, girls, and boys that are socially constructed. There is no biological gender, which is very important as we continue to explore this. And intersex is an umbrella term that's used for differences in sex traits or reproductive anatomy. There are numerous differences that can exist, and they can range from minor. The scope of intersex, however, is far greater than we have time or ability to go into in this presentation. What is gender anyway? There are two main aspects that make up the idea that we call gender. There's the identity and there is the expression. Gender identity is something that is internal. It's who you are to yourself and how you feel in your head. And this is things that we know where we can say, oh, I'm a girl, I'm a boy, I am gender fluid, and this is our identity. The other aspect of gender is that of expression. This is the external aspect of gender, and it focuses on how you appear and behave and how you present to others. So, how you express your gender and what your gender identity is may not always match the stereotypical societal expectations for gender, but that doesn't negate either your identity or your expression. Cis or trans, there's more than two. One of the most important things to remember here is that it's not just about whether you're cisgender or transgender, whether you're male or female, man or woman, or if you're non-binary or gender fluid, that none of these terms actually encompass intersex and are often excluding intersex from the discussion of sexuality and gender, which does them a disservice. In addition, if we aren't giving intersex people a place at the table, we can't actually have a true discussion about any of these topics. Intersex. In a study by Interact in 2021, they revealed that the number of people who are born intersex is actually 1.7%. One of the most common misconceptions surrounding intersex people is this idea that they can be fixed, that they are actually just one or the other, and even medical professionals, such as doctors, will encourage parents to perform surgery on intersex infants to correct what they see as a problem. What they fail to take into consideration is that there is not anything inherently wrong or disordered about being intersex. They are healthy the way they are, and these traits are more akin to variations. There are occasionally some issues that can require surgery, such as needing to clear a blocked urethra. That is something that's medically necessary and not cosmetic. Oftentimes, however, parents and doctors in society put a great emphasis on cosmetic surgery, and one of the detriments to this is it is being done without the consent of the intersex individual. And what we've been learning talking to intersex people as adults who've had these cosmetic unnecessary surgeries is that they regret that they happened to them and they wish they could have had a choice. It is important to acknowledge that there can be health issues with certain intersex trait variations, but these generally don't need surgery. When it comes to things like controlling hormones based on the body's ability to make them and or regulate them, that is something that is done via things like medication and does not require surgery. And the most important takeaway at the end of the day is that it is for the intersex person to decide whether or not they want any type of cosmetic surgery. The Gender Affirmative Lifespan Approach, or GALA, is a developmental model that has been brought together and presented by Catherine G. Spencer, Diane R. Berg, Nova J. Bradford, Jennifer A. Venzel, Ghazal Talawi, G. Nick Ryder, in a paper that was published in 2021 with the American Psychological Association. It is easy to want to put everyone into a single universal developmental model. Unfortunately, that does not take into account people as individuals, and especially when it comes to people who are transgender and gender diverse, that raises more issues that don't recognize certain things that are unique to their experiences. A quote from the article is Gala's lifespan philosophical foundation asserts that development is important and ensures that the mental health needs of different age groups with different developmental trajectories can be met. Treatment guidelines developed for adults should not simply be adapted to apply to other age groups such as adolescents or elders. Rather, the unique experiences of every individual in relation to their age and generational cohort should be centralized in all aspects of psychotherapeutic collaboration, since relevant interventions will differ based on these variables. Taking into account and honoring these basic distinctions supported in developmental research is an important aspect of GALA. As we'll see, while there are core tenets of this developmental model that are universal across the lifespan, the importance for these differences is based on what is actually age appropriate. The core therapeutic components of GALA are fivefold. They include gender literacy, resiliency to stigma, beyond the binary, pleasure-oriented positive sexuality, and connections to medical interventions. The first of these components is gender literacy. This is considered to be developing the awareness and skills necessary to be a critical consumer of these gender narratives. This varies based on age. For children, it presents more as externalizing societal rules and stigmas regarding gender, empowering their agency surrounding the narratives, as opposed to what typically happens, which is an internalization of these rules, leading to feelings that they are wrong or not real. For adults, however, it presents more along the lines of developing a critical conscience regarding gender narratives, especially with regard to ideas of the things that one is supposed to do as part of transition. Again, this is about not internalizing whatever misinformation, myths, or ideas that other people, generally cisgender and often men, have regarding how things are supposed to go. There is no right way to transition, and it is important to validate and affirm every individual's own narrative. The second component in the Gala model is resiliency to stigma, also known as the role of psychotherapy. From the paper based on minority stress theory, transgender resilience intervention model identifies resilience factors at the individual, group, and community level that can prevent proximal stressors, e.g., internalized transnegativity, from developing and buffer against the influence of distal stressors, e.g., discrimination. At the individual level, it is important for mental health care providers to combat societal messages that can contribute to feelings of shame and internalized transnegativity through assisting transgender and gender diverse clients in developing a sense of self-worth and validity. Looking more closely at these three levels, we have first the individual level. This entails learning coping mechanisms to combat day-to-day stressors and things an individual faces. This is encouragement of their individual identity and also assisting them in adjusting their relationship to messaging from all aspects of society. On the group level, some of the important things here are facilitating connections within the transgender community. This, of course, does need to be done based on the client and as an individual. While it is good and helpful for some people, it is something that has been shown to unfortunately decrease their resiliency and heighten feelings of depression in others. Then at the community level, we have something that is falling on the shoulders of mental health providers and the role of psychotherapists. This is advocating and lobbying for changes, both to law and society. Without addressing this issue, we are merely perpetuating a society that promotes trans negativity, trans misogyny, transphobia, amongst other things. The third component is that of beyond the binary. From the paper, heteronormative and cisnormative binary enforcing gender assumptions permeate transgender healthcare. Early guidelines for transgender care were steeped in colonized and patriarchal frameworks of heterosexuality and binary genders. Transnormativity became the unchallenged status quo in transgender healthcare, including binary understandings of gender, compulsory heterosexuality, and rigid, stereotypically normative Western gender roles. One of the examples they give in the paper is how our society is set up to enforce binary even when it comes to transgender and gender diverse people, such as insurance companies don't recognize gender queer non-binary individuals as having a valid gender, and this can cause problems if they are seeking various medical interventions that people who identify on the binary don't have to face. As part of this, the onus is on healthcare providers, whether they're doctors, whether they are therapists, etc., to acknowledge and accept the legitimacy of gender outside binary assumptions, and also to challenge pre-existing social notions of cisnormativity and transnegativity. It is vital for healthcare providers, especially mental health care providers, to advocate and support their clients who are outside the gender binary and to affirm the validity of their identity faced with a society that often tries to completely erase that. The fourth component of Gala is pleasure-oriented positive sexuality, or POPs. From their paper, research and practice have largely focused on negative sexual outcomes, e.g. sexually transmitted infections, STIs, for transgender and gender diverse people, and have lacked the integration of a sex-positive framework. Such an approach serves to perpetuate long-standing transphobic narratives of sexual deviance and disease, rather than depathologizing and legitimizing the diversity of human sexual experiences. Thus, developmentally appropriate psychotherapeutic interventions are aimed at adopting pleasure-oriented positive sexuality as one of the core components of Gala. This is something that is not endemic to transgender and gender diverse people, and it is something that is actually endemic across the spectrum of sexuality and gender, in that we have a society that still entertains these beliefs and ideals and concepts that stem from a puritanical look at the world. Regardless of gender, sexuality, or ethnicity, it's very important that we actually embrace sex positivity, especially within the realm of psychotherapy. Sexuality is an integral part of humanity. Part of the ways this can happen is by finding innovative and creative ways to support sexual satisfaction. Also, creating and developing pleasure-oriented interventions. Things that may come up in these situations are the idea of feeling dysphoria when it comes to sexuality and engaging in sexual actions, as well as concerns as to what differences there may be post-surgery should they choose to go the route of surgical interventions. Also, it's important to challenge the cisnormativity and heteronormativity that are embedded into our society. But above all else, it is important for us as a society to embrace and accept that all bodies deserve pleasure. Pleasure shouldn't be something optional, nor should it be a privilege. The final component to Gala is connections to medical interventions. From the paper, empirical literature has broadly supported the link between medical interventions and improved mental health, often reaching normative values following gender transition. Given the history of the gatekeeping model in transgender health, shifting the paradigm toward facilitating empowering connections rather than implementing barriers to medical interventions is a core component of Gala. This is especially important for healthcare providers, as we are holding that place as gatekeepers, in part thanks to requirements for referral letters to engage in surgery, and in some states, requirements to have a referral letter simply to change your name or your gender on your driver license. To help combat this, engaging and participating in the team of providers working with a client helps to provide unity and prevent potential for miscommunication or further gatekeeping. Another important facet is collaborating with the clients on required referral letters for surgeries. Rather than simply dictating what there is to be said, you are inviting them in, and so you are helping by presenting what they want to say and what they're comfortable with. Again, maintaining transparency throughout the process and fostering an environment of informed consent to support the client's autonomy when dealing with a situation where a great deal of historical gatekeeping, and not just historical but current day gatekeeping. Anything that can be done to help balance the power narrative and put the control back in the hand of the individual is important and necessary. Reproductive systems, gender not required. There are two reproductive systems in the human body. There's the penile reproductive system and the uterine reproductive system. It is important to note that while some people and organizations may refer to the penile reproductive system as a male reproductive system and use male in terms of sex as opposed to gender, there's no need to engage in that sort of language when we have a perfectly apt non-gender description. The penile reproductive system is both internal and external. One of the fortunate things is that Planned Parenthood has provided non-gendered images of and diagrams of the reproductive system, which can be used for educating all ages. The second type of reproductive system in the human body is the uterine reproductive system. Again, Planned Parenthood has some excellent clear diagrams demonstrating both the internal and external reproductive system elements, and again, giving us the concept of uterine reproductive system without needing to rely on more gendered sounding language such as female reproductive system. Having addressed the concept of gender and moving beyond the binary, as well as sex as it relates to reproductive systems and biological functions, brings us to sexual orientation. This is a multifaceted subject, and there are differences in the different types of attraction that can be wrapped up and part of sexual orientation. Someone could have sexual attraction and a romantic attraction and have them not be the same, yet still identify as a specific orientation. Most well known, of course, is the concept of heterosexual or straight and homosexual, also more specifically gay or lesbian. In addition, there is bisexual or pansexual. Some people prefer the term omnisexual. Others prefer just the simple overarching encompassing term of queer. In addition, the number of different orientations one can identify with is vast and always growing. Taking everything we have discussed, now we're going to apply it all through the lens of the development and the lifespan, beginning with infancy and toddlerhood and continuing up through late adulthood. We'll start in the beginning with infancy and toddlerhood, or the period from about birth to around 3 years. Yes, even toddlers know their gender. A quote I'd like to read is as follows. For children who present with the DSM-5 diagnostic criteria for gender dysphoria, the age of onset of symptomatology is almost always during the toddler and preschool years. An exception might be made for a child with an intellectual disability. The core elements include a strong wish to be or a persistent claim that one is of the other gender. Other common signs may include cross-dressing, cross-gender play, and playmate preferences, and sometimes marked dislike of one's sexual anatomy. It may be hard for some people to accept, but children know who they are, and the idea of gender is something that is often very... Why is my toddler masturbating? Masturbation is normal and healthy. It's natural for children, even toddlers, to begin discovering their body and what feels good to them. Even babies begin to experiment by learning about their body and touching it and discovering it. They are learning who they are and what shape they have, and relation to this wide new world around them. There is nothing wrong or disturbing about toddlers masturbating. This is something that can be encouraged. However, it's also a great time to encourage things such as consent, boundaries, and health. These topics are always good to begin from a very young age. You're never too young to begin conversations surrounding things such as consent and boundaries. Ways to do this include discussing appropriate places. It's not appropriate to touch your vulva at the dining table. It's not appropriate to play with your penis in the living room. This resolves around consent of others, in that other people have not consented to observing this behavior. It's okay to go and touch yourself in your bedroom, or say the bathroom, somewhere private. It's important to express this to them without making them feel like it's something they need to hide. Another aspect of this is encouraging them to wash their hands before and after touching themselves. But it is also important not to say that in a way that makes it seem like you're calling masturbation itself dirty. One way to do this is to discuss how you want to help prevent the spread of germs. And it's very simple and something that they're already starting to learn. If you cough or sneeze, you need to wash your hands. If you are going to eat, you need to wash your hands before you eat. Another very necessary piece to this is to remember that how vitally important it is to use appropriate terms for body parts. Studies have been done to show that children who know appropriate medical terminology for body parts are less likely to experience child sexual abuse. These parts are using vulva for an external, or labia as the lips of the vulva, and vagina for internal. It is important to distinguish that vulva is external and vagina is internal, as opposed to simply referring to the vagina. For the penile reproductive system, the parts include penis, testes, and for all children, anus. It may seem uncomfortable at first to use these terms, especially if you weren't raised using them, but the more you say them and the more you use them, the more everyday they become. We don't use fancy words for talking about whether your head hurts, or your knee, or your stomach, or other parts of your body. There's no difference between these organs and the other organs in your body. The next phase of development is early childhood. Moving on to early childhood, or the age range of about 4 to 7 years. Gender. What does your heart tell you? You can start introducing elementary notions pertaining to gender identity when your preschool child shows increased awareness of gender distinctions. Stress that being male or female revolves around inner feelings rather than physical attributes alone. Make it understood that although females usually have vulvas and males normally have penises and scrotal sacs, these attributes do not define everyone's identities accurately. Addressing these from a very young age raises your child with the idea of diversity as normal, healthy, and not something to be questioned. Your preschooler deserves autonomy. It's important as parents to remember that our children are their own unique person. They aren't just a mini me. Their concept of self is growing. but how often are they actually afforded their own choices? This is something that can be very difficult for young children, as oftentimes boundaries need to be enforced, and they can't always choose whether something is safe or not. So, any time that they can safely make a choice, it's important to allow them to and encourage them to. Consent and boundaries go hand in hand. Being able to establish boundaries is important because without being able to establish boundaries, you can't give consent. You can't give consent without being able to establish boundaries surrounding that consent. The best tools that you have with which to equip your child regarding consent and boundaries are accurate knowledge and accurate terminology. Some things to keep in mind are the fact that you can remind your child they get to decide to whom they show affection and from whom they will receive affection. Never say, oh yes, you need to hug Aunt so-and-so. They can decide if they want to hug Aunt so-and-so or if they want to allow Aunt so-and-so to hug them. You get to provide a safe space for your child to be who they are. You can establish trust early by accepting, affirming, and encouraging them to take as much autonomy as is reasonable at their age. And another important thing to consider is that peer pressure doesn't have an age. It is never too early to model and advocate for healthy relationships, especially as your child starts going to preschool and kindergarten and preparing for elementary school. Enabling your child to have agency is one of the best things that you can do for them. Rearrange your concentration from your private distress to your kids' welfare. Realize that exploring these matters is critical for their holistic improvement and understanding. Being prepared to tackle challenging subject matters symbolizes your strong desire for their enriched upbringing and security. Many of these concepts are things that we feel awkward and uncomfortable with. Our personal discomfort, however, should not outweigh our child's welfare. It is important to put their well-being ahead of an emotional discomfort that we feel as adults and are more equipped to handle because we have brains that have finished developing and years of life experience from which to draw from. And we have spent time developing our social emotional maturity. Then we have middle childhood, which is from about ages 8 through 11 and is also known as the prepubescence time. Moving on to middle childhood, or around ages 8 through 11, to the binary and beyond. For prepubescent children, one of the building blocks of future, pleasure-oriented positive sexuality is feeling as confident and comfortable in one's body as possible. Thus, therapeutic interventions need to focus on A, promoting a sense of awe and curiosity about bodies and all the wonderful things bodies can do for us. B, the understanding that there are a variety of ways that bodies can look, and C, dispelling the cis-normative belief that genitals or private parts or any other body parts define one's gender identity and gender expression. Don't make them come out. Coming out is something that we are very familiar with in these days, as people will come out with regard to their orientation or with regard to their gender identity. To help reach actual true equality, it's important that we don't keep putting an onus on an individual to come out. If we can normalize any gender identity, any sexual orientation, then it's simply a matter of your child knowing who they are or whom they care for and are attracted to. It's considered normal. It's not something that is different or special or needs a great deal of emphasis placed on it. Validation begets confidence. It is vital for parents to validate their children. Let your child explore and express their emotions without judgment. Feeling safe, accepted, and valued promotes communication. The safer and more valued that your child feels at the younger age, the more they will communicate with you as they continue to grow older. Again, accurate information now will give them the tools to combat misinformation on their own and better prepare them for things they might hear from the media, from peers, etc. You are giving them what they need to be able to be independent and make their own safe decisions. Pre-adolescence is a formative time. Open discussions and refraining from criticism will prepare your child for a better adolescence. Don't wait for school to get around to touching on puberty. Knowledge and preparation are the greatest antidotes to fear. There's no need to fear these upcoming changes in your body if you know what is coming and what to expect. Instead of keeping this as some shrouded, mythical thing, drawing back the blinds and calling it what it is helps to prepare children for what is coming. They know what to expect, they're not surprised, and it can aid in feelings of uncomfortableness, awkwardness, and the intensity of emotion that comes along with puberty. Oftentimes, as well, your school isn't necessarily teaching puberty when puberty is beginning to occur. Information after the fact does very little to help with fear and knowledge during the fact. Facilitate an environment that normalizes sexuality and orientation. This goes back to the idea of not making them come out. This is just a part of who they are, and it's not a secret to be revealed. A conversation I had with my own daughter involved her telling me about how one of her friends identified as lesbian. And when I asked her, "Oh, well, what do you identify as?" and she was just like, "Oh, bi." There was nothing about coming out, it was just a normal option that one could pick. Whether similarly to, "Oh, I want pink." Healthy relationships of any form are beautiful. Relationships are like a spectrum, with each type bearing its own dynamics, expectations, and levels of commitment. To teach your kids about embarking on the journey of building relationships, it's essential to acknowledge and teach the various forms of relationships. From the blissful days of dating to the days of committed relationships, the joyride of casual partnerships, the thrill of casual sex, the uncertainties of situationships, and the thrill of ethical non-monogamy. By embracing a positive and unbiased attitude, we can assist the kids in navigating the complexities of different relationship dynamics. It's important to not perpetuate the idea that a relationship should be one man and one woman. One of the benefits of normalizing different types of relationships is that it helps to reduce senses of shame and feelings of guilt. This doesn't mean that every type of relationship is appropriate for every individual. What it does mean, however, is that they are all accepted and valued without emphasizing one over another. Good vibrations. This may be one of the most controversial things I'm going to discuss. There is no ideal age to provide your child a vibrator. It varies by individual. Yes, I am talking about vibrators as in sex toys and children. There is nothing wrong with a child masturbating. We've already discussed this. As an extension, there is nothing wrong with a child using a toy to aid in self-stimulation. Some signs that they may be ready include your child finding your own sex toys, or using other household objects or furniture for self-stimulation, or even vocalizing a desire to have something to use. Encouraging them to learn about themselves, their body, their sexuality, and discovering pleasure is healthy and acceptable. There's nothing dirty about a child who masturbates. You might not feel comfortable with the idea of your child having a vibrator, but guess what? Once you've acquired one for them, you don't need to worry about it anymore. It also helps to, again, increase talks of health and safety and things that are appropriate or inappropriate. Using somebody else's sex toys, for instance, is not healthy or safe. This way, you are giving them something that they have the autonomy to choose what and how and when they use it. Masturbation is less complicated than sexual interaction with others, and it familiarizes your child with their body. If your child is engaging in masturbation, they are less likely to look for sexual stimulation with other people. It's important to remember that what you are doing is allowing your child to explore their sexuality. You are not participating in their sexuality, and it's not wrong or dirty, even though we are often conditioned by society to think that sex should only magically appear once someone gets married. Adolescence, or 12 to 19 years, also known as the teenage years. Adolescence, or that period from around ages 12 to 19 years of age. Let's talk about it. Open, honest conversations were had with friends, family members, intimate partners, and influential others, as well as larger societal conversations surrounding women's bodies and gendered expectations. Such discussions created a safe space for individuals to explore their preferences, including contraceptive and menstrual management options, and expressions of sexuality and intimacy. Conversations that encouraged acceptance of developing and changing bodies and prioritized finding menstrual and contraceptive management options that suited each individual were critical to disrupting feelings of shame, stigma, and concealing behaviors. Oftentimes, our society makes everything surrounding sex and sexuality seem dirty or wrong or taboo. It's not something that you can talk about and discuss in polite society. This doesn't mean that it doesn't get talked about anymore. It just means that what does happen happens privately in secret and doesn't have any way of exploring whether or not the information that's being shared is actually correct and accurate. By talking about this openly, you're encouraging your adolescent to open up and learn about themselves and also how to communicate about it. What you're doing is letting your adolescent know that it's okay to talk about things with you, that you're not going to shame them or they're not going to end up in trouble because of something that they think or even just want to know. Knowledge is the most powerful tool that we can give to anyone, but especially our children. Adolescents have rights too. One of the important things to note is that abstinence-only education, which is sadly often the norm in many states in our country, doesn't actually reduce teen pregnancy rates, penetrative sexual assault, or sexual activity. Abstinence-only education only teaches children and adolescents that abstinence is the only option. However, children are not going to simply accept that and will, under the influence of peer pressure, the media, and other sources, experiment and want to learn more. In addition, whenever we make something seem taboo or off limits, it can encourage adolescents to only want to do it more. What is this thing that we are trying to keep from them, and why can't they have it? Comprehensive sexuality education, on the other hand, affirms abstinence as a valid choice throughout the lifespan, and also doesn't shame those who choose to not remain abstinent. The importance is that all of these choices are presented as equally valid and acceptable and okay and normal. If someone wants to remain abstinent, then that's absolutely their choice and they should be encouraged. If they don't want to remain abstinent, they should be armed with the knowledge to be able to stay safe and maintain a healthy relationship with sex and improve communication and advocate for consent or refusal. Our society is built on systems that reinforce and accept neglect and abuse within intimate partnerships. This can be seen even in our legal system, where we have people who have sexually assaulted others, and we still nominate them to the Supreme Court. However, by centering accurate knowledge, education, consent, and pleasure, that we are giving our children and society the strongest method possible of dismantling these systems that have a dangerous and harmful effect on society. Instead, we will be enabling them to embrace diversity and inclusion. We also are enabling them to have a stronger sense of self-identity and giving them the tools to be able to say no and recognize when relationships are healthy versus when they are not. Self-advocacy is a very powerful thing. Early adulthood, from the 20s through your 40s. Early adulthood is the phase that takes place between your 20s and your 40s, which is wonderful for anyone who is still in their 40s. They get to know that they are still in early adulthood. But adulting, what about it? Why is it so hard? The assessment should explore the biomedical, intra-individual, misinformation, myths, lack of information, negative attitudes, anxiety, cognitive interference, psychological distress, lifestyle, and interpersonal techniques, communication, sexual script, relationship distress, dimensions of the sexual problems. It is important not to assume that sexual concerns fall along traditional gender roles. That is, despite the traditional sexual script that values high desire for men, but not for women. As adults, we are now in even more control of the sexual scripts we have and that we need. But we aren't often prepared to take on that type of personal responsibility. Maybe we don't have it all figured out after all. It's not going to all make sense when you're older. No, you don't have to know everything. Knowledge and understanding don't just magically appear because you've, congratulations, made it a certain number of revolutions around the sun. And not having it all figured out doesn't mean you're a failure. Aging doesn't bring sexual confidence by osmosis. Communication is still paramount. One of the things that is important to remember is that sex education is not, comprehensive sexual education is not something universal in the United States. When people aren't getting comprehensive sexual education in school, in elementary school, middle school, high school, and then when they move on to college, oftentimes classes just gloss over it with oh, you already know all this. And so they still aren't receiving this education in college. Then, once you're moving on into the world, having graduated, whether you're going on to graduate school or getting a job, or even not going to college and just getting a job, there aren't many opportunities to receive sexual education, leaving individuals, adults, in positions where they're still trying to figure out sex and sexual scripts and comfort and boundaries, and they may not know what they are until after something has already been crossed and violated. This is a disservice that our society is doing to everyone within it. Transitions abound in adulthood. They don't just exist in childhood through adolescence. Issues may arise that adults haven't even considered before. In fact, it turns out that we haven't even researched sexual experiences of women who transition to parenthood. We don't know what kind of sexual experiences or feelings they have going from prepartum to during pregnancy to postpartum. When scientists haven't done this research, how can an individual be expected to have all the answers? Other issues that we know are that fertility problems can lead to a vicious cycle of relational distress, sexual dysfunction, and even lower sperm quality, which of course leads to perpetuating of issues with fertility. In order to combat this, the best thing we can do is provide access for community sexual education. The need for learning doesn't just disappear because someone has become an adult. An important part, however, of self-education is knowing where to go to find answers. It can be difficult to learn things when you aren't even necessarily sure what it is you don't know. Middle adulthood, or ages 50 to 69. Middle adulthood encompasses the period of one's life between one's 50s and 60s. Screw society. And yes, that is a double entendre. There exists a social belief that older adults are non-sexual beings. As such, older adults may not be able to guard themselves from internalizing such messages. As Schubert and Pope wrote, in societies where messages of beauty, health, and sex are ascribed to young people, older adults are challenged with their own sense of beauty and sexuality. Older adults might find themselves conflicted if their own sexual desires are challenged by social mores. Some may resign their desires and refrain from seeking out physical intimacy in order to maintain moral and social connections with family. This is a very sad and disappointing fact about our society. Instead of encouraging and cherishing individuals for who they are and affirming their sexuality throughout the lifespan, to make them feel that in order to maintain connection with family, they need to ignore their desires and refrain from relationships, especially physical ones, is inappropriate at best and harmful at worst. There should be no reason for someone to have to sacrifice an important part of who they are in order to make their family feel more comfortable. Our society is gradually growing to accept this in terms of things such as gender, identity, and alternative sexual orientations, so long as somebody is young. That makes it more socially acceptable. Regardless of orientation, whether it's homosexual, heterosexual, or something else, age should not be a prohibiting factor. It is past time to reject anti-aging bias. Desire continues across the lifespan. Everyone should be able to embrace their sexuality. Desire for sex doesn't fall off the table because, oops, my children are now in college and grown. Systemic societal narratives try to shoehorn sex into a box for the young and beautiful, or at least, according to societal standards, what is young and beautiful. Oftentimes, that's not a standard that is inclusive of those in middle adulthood. Self-empowerment and self-agency help combat these myths, and it's important for individuals to be able to take a stand, validating and affirming them for who they are, the totality of who they are, is vital for positive and mental health, especially as they start aging. For people who have children, having the children leave the nest can be viewed as an opportunity to redirect personal focus. Taking time for oneself is always important, and it can sometimes be difficult to remember, especially with the way our society views people and transactional lifestyle, that in order to help and be there and support others, one has to first take care of oneself. This doesn't stop simply because someone is a parent or even a grandparent. Late adulthood or 70 and up. Late adulthood from your 70s and beyond. Grandma still got it. Simply because others might view older sexual expression in a negative light does not mean that we need to subscribe to that belief. Desire continues across the lifespan. It makes no sense to act as if we no longer desire just because we turn a certain age. Similar to a child who desires to explore their genitals, to the young adult who enjoys multiple partners, to the older adult who desires to dry hump or to rub genitals against another person's body, it is all relative. There is no yum to yuck. That is to say, sexuality in all of its expressions are valid. Sexuality doesn't become gross because someone has reached a certain age or has a certain amount of wrinkles. People can have active, healthy, fulfilling sex lives well into their 80s and beyond. This is something that we should be encouraging, not discouraging. How do you think you came into the world anyway? Yeah, you might not want to think about the fact that your parents did it back then, and you may not want to think about the fact that your parents are still doing it now. That doesn't change the fact, however, that becoming an elder doesn't remove one's sexual needs or desires. You should never underestimate the power of creation and innovation, especially when it comes to sexuality. As aging occurs and changes may come in ability and health, etc., that doesn't mean that desire or ability to have sex or engage in sexual practices even has to go away. What it simply means is that there's a possibility that what our sexuality looked like before is not what it looks like now. That doesn't make it any less than what it was before. It's especially important to acknowledge that entering a nursing home doesn't mean your sexuality gets left at the door. Caregivers, families, and staff don't get to say no for you just because they don't want to think about it. It's important to remember that any of their problems with older adults as sexual beings are just that, their problems. That doesn't mean that because they have a problem with it, you have to deny who you are. If we judge the acceptability of anything purely on individual comfort levels, nothing would end up being acceptable. Nobody would agree. Instead, informed consent and autonomy are necessary. Of course, there are some who may bring up the point of, well, can older adults actually consent? And that's part of the reason that we have caregivers in facilities for elderly people who have dementia or Alzheimer's or something else like that. There is not a you can consent, you can't consent, black and white. There are different things that one can consent to and one can understand. And for those who are working with older adults on a regular basis, they're able to see and judge and talk with the individuals to help get an accurate idea of what they understand about things and what they can consent to. Oftentimes, it's just the families who object to viewing their older family members as having sexual needs and desires even at a later age. Again, how do you think you came into the world anyway? If you are family to an older adult, you need to remember that they still deserve as much autonomy as they are able to have. And that includes the ability to be a sexual creature. Of course, safe sex practices still matter, because even if you can't get pregnant, it doesn't mean there aren't other risks to mitigate. Things like sexual education in nursing homes are incredibly important to support. Things like making sure contraception such as condoms or dental dams are available in nursing homes is also important. Certainly, an older adult might need more lube than someone in their 20s, but everyone should be using lube anyway. Most of all, however, it is important to remember that individuals are just that, individuals. No two people are exactly alike when it comes to sex, sexuality, or gender. What matters is the way we embrace them and accept them and validate them for who they are, and as a society, make it something that is an acceptable part of life and not something that needs to be hidden in the closet as some dirty secret. Sexuality and gender are topics that encompass a great deal and cannot be fit in depth into any type of PowerPoint presentation. So, for further research, for reading and learning more, I have included a list of references to various books, articles, papers on these subjects. It is my hope, however, that this overview has given you a jumping off point for learning more and perhaps even challenged some ideas that you didn't even know you had. And remember, while X doesn't always mark the spot, sometimes G and sometimes P do.